Thank you so very much for this opportunity to be up here. Sometimes as a resident, especially as an intern, which I'm completing my intern year currently, you sometimes feel like a small fish in a big pond. And I was initially approached by Carla while I was doing an AUC open house for prospective students. And I was very honored and very grateful for the opportunity. And I felt, what could I possibly give and provide as a pediatric resident. However, sometimes as a resident, we are the first line. We do see the patients and we see the babies first. And maybe I can provide my perspective and the challenges that we face at New York City, and in my particular institution, and where we can move from there. And I also want to give special thanks to Dr. Taylor, who is my dean at AUC. I had an amazing time at AUC. It was a great opportunity. I essentially did medical school in 4 different countries, and it was a great opportunity just to see the differences amongst all the different, the countries and institutions. So my topic today is my baby will not latch and other breastfeeding challenges. And I see that you were born at Maimonides, and as mentioned over there, were you breastfed? That's the question. 6 months. That's the AEP recommendations. So I have here as my first slide a quote from Olivia Wilde, as many of you know, is an amazing actress. She says, breastfeeding is the most natural thing. And this was as a response to her 2015 Glamour magazine shoot. She was on the cover of the magazine, and she was here seen clad in a very beautiful dress in a modern diner, her baby naked and happy, breastfeeding, and she seemed so happy and it looked so effortless. However, she did get a lot of backlash for this because many mothers could not, agree with her that breastfeeding is effortless and easy. So for a lot of mothers, this was seen as almost a slap in the face, that this is not their norm. Another example is a quote here from a model, Giselle Bündchen. She says, "What would I do without this beauty squad after the 15 hours flying and only 3 hours of sleep?" And this was an Instagram picture that she posted. Hashtag multitasking, hashtag getting ready. So while this looks amazing that she was able to sit in her terry cloth robe clad with her beauty squad and, effortlessly baby breastfeed her baby, for the reality is most women are not able to do this in the workplace so effortlessly. So again, the reality of these amazing actresses and actors coming about with breastfeeding is not the reality for a lot of mothers. And so for them, they see this incongruency and they wonder what can be done for us. So the first part, so the breastfeeding challenges that I wanted to touch upon are several fold. So there are some physical challenges that we must talk about, stigmatization of public breastfeeding, community challenges, and institutional challenges, particularly at my institution. So the first challenges that I wanted to talk about were the physical challenges. And again, these are some things that we as pediatricians or even OBGYNs, we hear the moms talk about when we ask them, at their 2-month visit, are you breastfeeding? And they've already said that they've stopped, and we wonder why. And these are some of the things they tell us. And as clinicians, we usually gloss over it. Okay, so you're not breastfeeding, so how many ounces of formula, blah, 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 every 3 hours, how many wet diapers? And we don't really, explain or try to encourage the moms to overcome these challenges. And some of the things that we can do as clinicians is to possibly give some tips, because a lot of times, even though we do have lactation specialists, they're not there for every single patient, or definitely not there after they leave the hospital. So the reasons why we care about this, and most of you know this already, is that the AAP recommends that babies be exclusively breastfed for the first 6 months of life. And the baby actually does not need any additional foods with the breastfeed, so no formulas. However, there is a recommendation by the AEP that these babies do, especially exclusively breastfed babies, have a vitamin D supplementation, because the 2008 recommendation of AEP is that breastfed all babies need at least 400 international units of vitamin D. And although breast milk does contain it, it doesn't contain, they're not able to get the appropriate volume to get the appropriate number of vitamin D a day. So 400 international units a day. So what we do is for exclusively breastfed parents, moms, we actually give the babies what we call Trivisol, which is a vitamin A, D, and C supplementation. So besides that, babies do not need any other additional supplementation. Also, they recommend that the babies can continue breastfeeding further, continue for a year, and they can actually start feeding with solid foods at that time, as long as it's mutually desired by both mom and baby. So the reasons for these recommendations, you know it like the back of your hand, and we've discussed it in length, that breastfeeding provides protective effects against respiratory illnesses, ear infections, GI diseases, allergies, asthma, and eczema, and the SIDS actually is lowered about a third, and 15 to 30% reduction in adolescent and adult obesity. So the benefits are even 10 pages longer than this, and so the recommendations stand as 6 months minimum for the breastfeeding. So when we talk about breastfeeding and we talk about the benefits, it's not something that's new to most parents. Most moms actually have the idea and the desire to breastfeed. And if you look at this graph, from the beginning of the century, you can see that there was a high initiation of breastfeeding, right? It decreased in the mid part of the century for reasons that I do not know at this point. But it did increase again because of the initiatives, and a lot of parents do understand and know that the benefits of breastfeeding are vast. And in New York City particularly, breastfeeding initiated for New York City mothers are actually about 90%. So the majority of parents actually do initiate breastfeeding for their babies. However, unfortunately, by 2 months of age, about 30% of these moms continue to exclusively breastfeed. So for whatever reason, about 70% of these moms stop breastfeeding between birth and 2 months of age for the baby. And yes, this is New York City. Mm-hmm. And so that tells you that at that point, from 0 to 2 months, there is a major disparity that needs to be addressed as to why these parents have stopped breastfeeding. And some of these challenges are the ones that I'm going to discuss. So some of the challenges that physical challenges that I hear from parents are that my baby won't latch or latching on hurts. So as a clinician or a pediatrician, what can I tell my parents, my patients, as to how you can help the baby? So very helpful tip is, reposition the baby. If latching on hurts, it's a myth that it's supposed to hurt. It is not supposed to hurt. So if it hurts, then you should reposition the baby, tickle the chin, open their mouth wide, and try to sandwich their breasts or your breast in between the fingers to shape it to the baby's mouth. So basically allows the baby to have a bigger mouthful. So you can, if it's done correctly, you can actually see that the chin and the nose of the baby will touch the breast. If the nipple is visible, then it's not a large enough mouthful. So some babies unfortunately bite into the nipple, and it causes a lot of soreness. And that's one tip that you can tell mom. Another breastfeeding challenge is that he falls asleep at the breast after a few minutes. I hear that a lot from some of my parents, and because of that, they assume that the baby's not going to get enough milk. So one way to tell parents is to make sure that to help the baby wake up by trying to express milk. One surefire way to help baby wake up is to have a mouthful of milk, and so just express the milk between your thumb and fingers. And once the baby feels the milk in their mouth, they will start sucking and swallowing. And if they fall asleep again, just repeat the process. There was one patient who, unfortunately, the baby had a little bit of failure to thrive because the mom just allowed the baby to sleep, and the baby just was not getting enough calories. So make sure that is told to the parents. Another challenge is my nipples are cracked and they itch. And if they're itching, that could be a sign of a superficial infection caused by Candida, fungal infection that can be treated very easily. Or you can even use ginseng violet, which is helpful if you put it right before feedings, because it actually helps treat the baby's oral thrush as well as the mom's thrush. So that's one thing that could be treated. And another physical challenge is that there's a hard lump in my breast and it's sore. So that could be a sign of a clogged milk duct. So sometimes the milk duct gets clogged if the mom is not expressing enough. or often enough. So one way is to tell the mom to keep nursing and to try to massage the bleb out with warm compresses. And in the future, to make sure that they're expressing every 2 hours. Sometimes mom express every 3 to 4 hours, and that could be sufficient for some parents, but not for others. And one more challenge is my boobs are engorged and swollen, and this is something that that really I'm sure could also be very painful. And again, this is a result of not enough expression and nursing. So frequent breastfeeding and hand expression before feeding will help relieve that discomfort as well. And that usually happens a few days after the baby's born because the milk production is revved up. Another physical challenge is I have a painful red spot in my breast. So any of the previous challenges that I mentioned, the clogged milk ducts, the cracked nipples, or even the engorgement can lead to a superficial bacterial infection called mastitis. And it's a superficial infection that can be easily treated with oral antibiotics against some of the common bacteria, like staph. And it also is associated with flu-like symptoms like fever and pain in the breast. So this great thing is that, again, this is something that is treatable. However, there's the myth that I'm not able to breastfeed. And so the great thing with this is that it is safe to continue to breastfeed even with mastitis. It does not cause harm to the infant. So in Maimonides specifically, I spoke to a few of the new moms in the nursery just a couple of weeks ago. And I explained, I wanted to just know what their issues with breastfeeding was, and if they wanted to exclusively breastfeed, what would be their challenges. And some of I spoke to 2 moms in particular that stood out. The first mom, she was very overjoyed, and it's the first child. And as soon as the baby came out, the baby was able to have such an amazing latch, a great latch, and she felt really happy about that. And she does want to continue to exclusively breastfeed her baby. However, she says that even though my baby had a great latch, my biggest fear is that I will not produce enough milk. So she said the reason she said that is because only a few drops came out. And so she thought it's not enough milk for my baby. So I'm afraid that's my biggest fear with breastfeeding. Another mom that I spoke to, she unfortunately did not have the same experience. Her nipples were flat and inverted. So her child did not have the opportunity to have a great latch. It was very difficult to get her to latch on. And when I spoke to her, I actually spoke to her nurse as well. And in speaking to her nurse, I could tell the nurse was very harried and frazzled and just really stressed. I wanted to say one thing about Maimonides is we are located in South Brooklyn, and we're located in an area that has a very high Orthodox Jewish population, a very high Chinese population, a very high Latin American, Caribbean. We're extremely multicultural, and so we actually see some of the highest deliveries in the state of New York. And it's upwards to 7,000 to 8,000 deliveries, and that's a very, very busy hospital for obstetrics and pediatrics. Therefore, sometimes even one person calling out is problematic because the nurses are understaffed and they have a lot to do. And in that particular day, there was an understaff. It was a full ward, and the nurses were understaffed and they were very stressed. And the nurse had several mothers who wanted to breastfeed exclusively, but she was, unfortunately, a lot of her patients were not able to breastfeed well. And so she had to help. There were no lactation specialists. It was a Sunday. And so she was very frustrated. And so she suggested to the parents to just give formula. And so that particular mother, she started to give the baby formula because she did not have any help in getting anyone to help her breastfeed because her nipples were inverted. But even with that, I asked her what her biggest fear is. And she said, between inverted nipples or flat nipples and not enough milk, and she said her biggest fear is not enough milk for her baby. So she was happy to give formula. So that is a common theme in the hospital that I work in. I'm not in possibly other hospitals in New York, and which is true in New York City. The top 2 reasons that New York City mothers give for giving up on breastfeeding is insufficient milk supply and feeling that their baby is not getting enough milk. And so this is something that is definitely a teaching point for these parents. And this is not their fault for thinking that, because if you want to breastfeed and only a few cc's come out, it seems very insufficient for the baby. However, one thing as pediatricians, that we can tell these parents is that usually the milk, when you think of mothers in other countries in the world, they have no other choice but breastfeeding. The babies grow well and they do well. And so why is it different than mothers in the U.S.? The babies the milk production usually is adjusted to meet the actual appetite of the baby. So when you think, so there are two times when moms feel like they don't get enough milk, and it's usually right after birth when they're only getting a few drops, and then the milk production revs up and they're getting a lot of milk, and then within about around 6 to 10 weeks, they see that their milk doesn't flow as much as anymore, and that's usually because the milk production is adjusted to to meet the actual appetite of the baby, and so that the milk doesn't start to flow until the baby starts to suckle. And one way as pediatricians to know whether or not the baby is getting enough milk, and these are practical ways, is to measure the baby's wet diapers, and that's the reason why for every visit we ask moms how many wet diapers are the baby producing per day. And that's very, very important to make sure that the baby is not dehydrated, and also the weight gain. So we plot the weight every single visit on a graph to make sure that the baby gains enough weight. One thing another issue that I've noticed for moms is that in the first couple of weeks, the baby tends to lose weight, which is completely acceptable. They lose about 10% of their weight, at least 10% is the acceptable rate, and they gain it back within 10 to 14 days. And the baby's losing all the excess fluid that they had inside, when they were in the amniotic fluid. And so the parents don't know this. They just think, oh, my baby's lost weight. Moms love to know how much the baby weighs, and they want to see a great gain. But in the first 2 weeks, unfortunately, their weight does decrease. And because of that, these parents think, oh, they're not getting enough milk, so they just tend to supplement with formula. So these are all teaching points that we tell parents, and we do it individually, but maybe the key is just to do it on a community scale. So we have these. Sorry, it's not a very clear picture, but we actually have these little signs posted around our nursery and then in the NICU everywhere to show these parents that, as far as they believe that the baby is not getting enough milk, but they don't actually perceive, although the baby's bellies, as all babies' bellies are protuberant, and they think their bellies are huge, it's actually the abdomen, the stomach itself is pretty small. So as you can see, the middle white ball in the center is the size of a baby's stomach, is approximately the size of a baby's stomach, like a shooter marble, on day one, from birth to day one. So it's the size is about 7 cc's. So that's about a teaspoon. So really, when you think about it, when the mom is only producing a few drops of milk, that is sufficient for the size of the baby's belly, and it grows as the baby grows. So we put these around, but I'm not sure how much of a difference it makes, because the parents still have these perceptions that they're not producing enough milk. So yes, thank you. So this is just a short video of, this is in England, and this is a video on the challenges that some of the women face while breastfeeding.
Public is not the only hurdle Linda has faced. Despite starting off well, she and some of the other mums we're about to meet began to find breastfeeding painful. Linda found that her breasts became uncomfortably full or engorged.
I had boobs out to here, huge boobs. And the difficulty was, Kiva wasn't latching on. Poor thing, I think I was just shoving her and hoping that she would find the right way. And obviously because the position wasn't right, I ended up with sore nipples.
Holly also found things didn't go smoothly. She ended up with various treatable conditions, including an inflammation of the breast called mastitis.
To begin with, it seemed very easy, very straightforward. For the first sort of couple of feeds. And after a couple of days, it was just the difficulty with latching on. But I had sore nipples, mastitis, and I also had an infection, a thrush infection. Come there.
First-time mum Heidi also began experiencing discomfort, and her baby wasn't gaining enough weight.
I think maybe Annabelle her mouth wasn't positioned in exactly the right place, and it just meant that she wasn't getting enough milk, and also that it was becoming quite painful for myself.
If your baby doesn't attach well, she may not take enough breast into her mouth, and your nipple might rub on the front part of the roof of her mouth where it's hard. This could be painful for you, and your baby may not get all the milk she needs. You can avoid this happening by making sure your baby attaches well, taking a good mouthful of breast so your nipple is drawn right back to the soft part of the roof of her mouth. Even if breastfeeding doesn't go smoothly at first, with the right support and information, You can turn things around.
I found it helpful to carry on feeding through the pain because it just helps with everything, especially with mastitis. You want to sort of keep feeding, and so when I was in a lot of pain, I sort of put him on the boob, and it was good from there, really.
I asked to be put in contact with a breastfeeding counsellor. From that moment on then, the breastfeeding counsellor always worked with me to keep a check on Annabelle, to make sure that she started gaining weight and to make sure that there were no further problems with breastfeeding, such as the poor positioning that I had at the beginning.
I rang the helplines, but I think it was having the face-to-face for me that was really important. And I think the turning point was whenever I went to the breastfeeding support group. I think it was hearing other women that really, really made me realise, look, they can do it, I can do it, you know. And seeing women breastfeed, that was a big turning point as well.
Through talking to the breastfeeding counsellor, but also through coming into contact with lots of other women, through going to the clinics, I was able to see that everybody's experience is different.
It's just the support from my mum and my partner helps me, because he was obviously there through the tears and everything, and I was lucky that I had my mum there to help me with positioning and everything.
To be a breastfeeding mum is absolutely everything to me. It's something that I didn't think at one stage that we'd be able to do. So yeah, it's an achievement for me, and I'm really, really pleased that as a mum I've been able to do it for.
So this was a very encouraging video showing the challenges that these women face, whether it was just a sore nipple or mastitis or engorgement, and yet they were able to overcome those because they had the support and the support staff and their supportive family, and seeing other women also go through this. So as a pediatrician, I do not have children myself, and sometimes these women are telling me all of these challenges that they face, and I wonder to myself when I tell them, how credible am I? So although I can give my medical knowledge, seeing other women who actually face these is more, to me, more strengthening. So that's one initiative. Another challenge that women face. So once they finally mastered, now they become pros at breastfeeding, they mastered all the physical challenges. The next challenge is now finding a place to do it without being shamed. So now we have a new problem. Now that a lot of women are starting to, be proud of breastfeeding, is that a lot of women are stigmatized for breastfeeding in public. So this is a quote from one of the flight attendants at a United Airlines flight. Help her out. So Christian Hilderman. She was on a United Airlines flight from Houston to Vancouver with her husband when her baby started to cry and take off due to changes in cabin pressure, which is common. So Hilderman decided to breastfeed her baby to comfort him, which is proven to really be helpful, whether, you put a pacifier or for adults chewing gum, just opening that glottis. It helps with the cabin pressure. So as she did so, a flight attendant walks by and asks if the man that was sitting next to her was the father of the baby. When he says yes, the flight attendant tosses a blanket at the father and tells him, then here, help her out, to say that, she needs to cover herself. And she was extremely embarrassed. She was very, very hurt at this situation. And this is the first time that this has happened to her. But imagine in the future, she'll be less likely to feel comfortable in breastfeeding in public. Another situation happened at Marshall's. This is a woman who posted this on her Instagram profile. She says, yes, this is me sitting in the toilet feeding my sweet Catalina Maria after I was denied my right to breastfeed where I wanted to by a Marshall's employee. So this is two of very, very, very many experiences that women face. In recent culture, with the breastfeeding epidemic coming about, a lot of women are facing these public shamings and they have nowhere to turn to. And another is a video that I wanted to show. This is an actual breastfeeding that someone caught on camera, a breastfeeding shaming.
Pues hazlo en tu casa. Hazlo en tu casa.
So I have no words for this. That is extremely shameful and very, very sad that this woman had to endure this type of shame and harassment for doing something that's seen as natural as drinking water to a lot of other cultures. So this is what these women are facing. And unfortunately, at this point, I don't know what we can do. I will admit, I do not know, besides just giving more support and just making this more of aware, just making more people aware of the benefits of breastfeeding. I maybe some of you can provide something that we can do as, a society that we can do to help with this. But this is something that's becoming more and more increasingly popular, which is really, really sad. So another challenge that I wanted to bring up are the community challenges of breastfeeding. And this is something that I'm very happy. As I was sitting there, many people who came before me spoke about these in more detail about the community challenges to breastfeeding, including the social and racial disparities. And this is something that we all are aware of. And we can't ignore the facts that race and income are the major predictors of whether a woman will continue to exclusively breastfeed for 6 months. So the highest rate as it stands now of breastfeeding are amongst wealthy whites. So women with low incomes, they have to face many challenges, which is something that we talked about all day today. One of them is having to return quickly to the workforce because there's no maternity leave. And also participation in WIC, as we spoke about today, is responsible for more than half of the U.S. formula consumption. So this is another quote for a woman who faced some of the challenges in the workplace. It wasn't feasible for me to pump because I was in meetings all day. This is from Josephine Giugliano, a 39-year-old mother of 3 from New Jersey. She said that breastfeeding is so hard in the beginning and no one really tells you that. And she admits that she felt like a bad mom when she could not continue pumping at work and had to supplement with formula. So these are just some of the personal experiences that moms are facing when having to go back to the workforce quickly after having a child. So formula, as we know, is advertised very heavily in television, in the radio, social media, coupons, blogs, free samples, even at the hospital, including my own. U.S. baby formula, as we know, is a very, very profitable industry, and someone mentioned that they've actually increased their marketing budget, and interestingly enough, in line with the breastfeeding agenda as well. And Mead Johnson and Abbott Laboratories are now the leading formula companies, but they do not view that their advertising is affecting breastfeeding rates. So one of the quotes from Abbott is that we market our Similac infant formulas to compete against other brands of infant formula, not to compete against breastfeeding. From Mead Johnson, it says, our research and development efforts are focused on making our infant formulas as close to breast milk as possible. So, we can be the judge of that. So some of the other challenges that I wanted to touch upon are the institutional challenges to breastfeeding. As I mentioned briefly earlier, is that formula is pushed heavily in hospitals. In my hospital, I have unfortunately witnessed some nurses, and they mean very well. And this is another case of short staffing, overstress, when their mothers are adamant about breastfeeding, but they're not latching on well, or the baby's sugar. Another very common factor is that the baby's sugar is low and the baby's not getting enough milk. So the nurses tell the moms they're going to have to get formula. And some moms see this as not really an exception, but more of a suggestion. And also just putting a can of formula in babies' gift bags tells moms. A lot of moms are on the line whether or not they should do the breastfeeding or not. And when we give them the samples, they say, "Oh, this is from a reputable hospital. These are from clinicians. This must be what they want us to do." And this is just the thought that goes through their heads, and so they just go and they go forward with. They usually do some breastfeeding and some bottle feeding, which is really interesting. Sometimes they start with breastfeeding for a couple of weeks and then they supplement with formula. And with the subsequent visits, you find out that more and more formula is being used, and they wonder why the baby must possibly not want the breast after being given formula in a nice large nipple that's very easy to latch on. And we always say to the moms, if you give them the choice between formula and breast, the formula is always easier. The nipples are easier to latch on with the bottles, and so they're going to choose the bottles. And so that's just something parents are very shocked, and they didn't realize that. And so I'm not saying that there's anything wrong with formula supplementation, but eventually they have to understand that the risks are involved with the baby's maybe choosing the formula over the breast. And so more than half of U.S. hospitals do offer moms free formula gift bags, and 7 out of 11 showed lower exclusively breastfeeding rates amongst those who did receive those gift bags with formula in them. So just another quote from the WHO is that the less a baby suckles, the more, usually because formula is introduced, so obviously the less milk the mom produces, because it tells the body that the baby is being weaned, and so they don't need to produce as much milk as before, and it sets a downward cycle so that mothers eventually have insufficient milk, and then they just exclusively breastfeed. So it is a cycle. So at my hospital, again, I spoke to a mother in the NICU. She was very pleasant. She was the baby was in an NICU, and she was very pleasant. And she told me that when she was pregnant, she had this ideal birth plan that as soon as the baby was born, she would initiate skin to skin, and she would start breastfeeding her baby, and she would run off into the sunset, and everything would be great. But unfortunately, the mom developed a fever, and the baby also had low sugar, and so right away the baby had to go to the NICU for sepsis observation, antibiotics, and the baby needed to get IV glucose. And so that moment, the mom missed her first opportunity for skin to skin and breastfeeding, and that already was very discouraging for her. And as the days went by, she said that she tried to pump, but she was not able to get it right, and so she now is just using formula. And she says she's very frustrated. I mean, you can imagine not being able to reach her goal of having what's ideal for her baby because of these maternal issues as well. And in our hospital, our NICU is on the first floor, but our nursery mother's unit is on the third floor. So that also creates another potential difference, because moms who want to be able to see their babies right away, they need, they'll have to get to an elevator, or if they had a C-section, they'll need someone to help escort them, and it's just not close enough. And a lot of times I've seen moms being frustrated because they're not able to get to their babies in the NICU right away to breastfeed. So that's another institutional limitation that we have. So we talk about these challenges. So how can we overcome them in my community? So many people have touched upon the New York City initiatives, and the public health goal of New York City is to make breastfeeding the norm. And as everyone spoke about earlier, breast milk friendly hospital initiative. And this initiative is absolutely amazing and very wonderful in optimizing infant feeding in birth hospitals through various measures. Unfortunately, I must say that my hospital is not a breast milk friendly hospital, which is it's actually a missed opportunity, because we have so many deliveries at our hospital, and we don't have this designation as of yet, and I'll say yet. So several talks have already touched upon this, but these are some of the 10 steps to successful breastfeedings, and they include having a written breastfeeding policy that is routinely communicated to all health care staff. And I would say that we do not have this. This is not, if it is there, it's not communicated to all healthcare residents. Do not know about them. And we talk about breastfeeding, but it's just as a way to document what the feeding plan for the infant is. But we don't have a real policy. If the mom says we don't want to breastfeed, we just document that. Train all healthcare staff in the skills necessary to implement this policy. Just a few weeks ago, we started having we actually had our first breastfeeding training. It was more of a online webinar training modules on breastfeeding and the challenges that moms face with breastfeeding and how we can overcome them. And it wasn't just for residents and doctors; it was also for nurses and other ancillary staff. And that was a step in the right direction. And I was very, very surprised and actually very, very, proud of it. So we do have the staff, and we have people in lactation specialists, and we have a whole team dedicated to breastfeeding. However, it was always in the background, and now I'm seeing a push towards putting it in the foreground, which is a step in the right direction. Helping mothers initiate breastfeeding within 1 hour of birth, that definitely does not happen. Again, due to staffing and a lot of other issues, this is something that we can work on in our hospital. Showing mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. And this goes with the mom that was separated from her child, and the child that went to the NICU. it's definitely something that we could use. And the other 10 steps are giving infants no food or drink other than breast milk unless medically indicated. So that's something that we medically indicated could be, a lot of people can have different definitions of that. However, that will be something very good and a step in the right direction. Practice rooming in, meaning allowing mothers and infants to room together, to remain together 24 hours a day. In my particular institution, a lot of parents drop off their infants in the nursery for the night, and that is not something that we encourage at all. Encourage breastfeeding on demand and giving no pacifiers or artificial nipples to breastfeeding infants. I don't believe we do that. I actually see a pacifier in every crib. So foster the establishment of breastfeeding support groups and refer mothers to them on discharge. And this is something that when I spoke to these moms, most of them had no idea, not only of the resources we had in-house, but the resources outside of the hospital. And they weren't giving information, or if they were, it was just something part of their packet that they got and not really something that they spoke about in length. So some of the outcomes showed that making breastfeeding the norm in U.S. actually has been successful in increasing breastfeeding initiation in hospitals citywide from 54 to 80%, and exclusively breastfeeding in the hospitals from 15 to 29%. So actually, the Friendly Breastfeeding Initiative has been very, very helpful from 2004 to 2008. So some of the rights that women actually have no idea that they have. The New York City Breastfeeding Council on Women's Rights in the hospital, they actually have the right to breastfeed their baby right after birth, keep their baby with them in their own room, receive help and information from any person trained in breastfeeding, ask for no bottles or formula to be given to their baby, refuse a pacifier, and turn down discharge bags that contain infant formula. The last one actually struck me because I don't think women knew that they actually have the right to refuse these gift bags that they receive, because it is a temptation and you don't want to bring it home. So in public spaces in New York, we actually have the right to breastfeed any place you have a legal right to be. So if anyone ever gets approached in New York and told that you're not allowed to breastfeed in the park, you're not allowed to breastfeed, it's actually wrong. They actually have a legal right and they're backed legally. So that's an important fact for women to know. And most women probably do not know that. As that woman in the video, she was intimidated to actually leave. In the workplace, women actually have the right to have a private place to express or pump their breast milk that is not in a bathroom, which is very significant, and they use their break time or meal time to express or pump. So again, how many spaces in most workplaces have a dedicated area where women can breastfeed that's not in a bathroom? Like the woman in the Marshall, she was actually in a dressing room and she was told to move to the bathroom, and she didn't realize that she had the right to stay where she was. So Latch on New York, someone touched briefly on that as well, is an initiative to help support mothers who choose to breastfeed. And the goal of it is to improve the health of moms and children by increasing breastfeeding initiation and duration and exclusively breastfeeding. So it's really a great effort, and it's helped a lot of moms, basically come together and just reduce minimize practices that actually interfere with their choice, with just like formula feedings or things of that nature. So hospitals also pledge at the end of to end the distribution of promotional formula and materials during the hospital stay and at discharge. And so a public awareness campaign to promote, so Latch on New York is also a public awareness campaign to promote the health benefits of breast milk and to inform women of their rights to receive education. So the Border Talk mentioned that there was a huge Latch on initiative where a lot of women just came together and just had a day to breastfeed together. And that is that may seem very trivial to other people, but it's actually very, very helpful to see women who are enduring the same challenges that you're enduring to come together and express the challenges and to know that you're not alone. So what is the role of a pediatrician? So this breastfeeding is obviously it's not just for pediatricians or OBGYNs or nurses. This is a multi-factorial and multicultural, multi-everything. Everyone needs to come together to help this initiative. However, for pediatricians particularly, what can I do? So we have a role, in our individual practices, in our communities, and in society at large to serve as advocates. And a lot of times we don't serve as advocates, as I mentioned, because when moms, mention their challenges, we just, we don't really overcome those challenges. We just say, okay, and what's next? We just care more about, is the baby producing enough wet diapers? But we want to actually help and support these moms when they mention of their challenges and that they face with breastfeeding, whether it's at the physical level, the community level, the institutional level, or even shaming. So the AAP website actually provides a wealth of information on breastfeeding related material and resources to help support and assist pediatricians when they do assist and advocate for these parents. And in my experience as completing the first year of residency, I don't think we've used, I know that they're there, but in our practice, we have not used them once. So there's definitely a gap there that needs to be filled. And other roles of pediatricians, including developing the necessary skills to assess for the adequacy of breastfeeding. So sometimes I go around to my mom, to the parents in the nursery, and they tell me, oh, I'm having this trouble breastfeeding and I can't help. And I run around trying to find the nurse or a lactation specialist, and they're few and far between because everyone's very busy. And so if we train pediatricians in being able to helping these parents overcome these challenges, so right at the bedside, these little tips can make a huge difference, and that can help close some of the gaps. And our role as individuals, as a group, is basically understanding that breastfeeding and the use of human milk does confer a unique nutritional and non-nutritional, it's not just about the nutritional, it's about the bonding as well aspect of it, benefits of the infant and the mother, which optimizes infant, child, and adult health, as well as child growth and development. So we should not consider, as someone mentioned, breastfeeding as being a mere lifestyle choice or just a fad. It's becoming very popular in the media, and some people are thinking that, oh, this is just a fad. It is a basic health issue. This is not an option. This is something that we should, get into the minds of people, that this is a health issue. This is not a lifestyle choice. This is something that should be, compulsory for new babies. The reason why I wanted to become a pediatrician is because I wanted to I love children. And for me, I feel like in healthcare, getting to the problem before it even begins, preventative care is so important. And we focus so much on, the well child visits and the immunizations and the vaccines and, making sure the 5210 obesity, preventing obesity. But, when we think about the breast milk being the ideal for the baby, and this is actually the first line of preventative care that we could touch upon, and it's something that we do not as pediatricians. And I believe that this is where we could have the most influence, because we are the ones that the parents see in the first few days after birth, the first couple weeks. There's so many visits, child care visits in the first few months after delivery, and we're missing an opportunity by not implementing this as part of the preventative health care for these parents. And my specific role, what I can do in my particular, what can I do tomorrow? Again, like I said, sometimes I feel like a small fish in a big pond in this, and I feel like, what can I do? I have such a small role. I'm just a resident. However, as residents, we're encouraged to participate in research and quality improvement projects, and I feel that this is something that could be, definitely implemented. I have a colleague who actually expressed interest in starting a QI project on breastfeeding, and obviously I'm very interested in it as well. And so this is something that I will, in the future, hopefully very near future, initiate a quality improvement project to implement these policies that we have in our hospitals. We have the framework, but where there's a gap in implementing them, and also into making our hospital one of the baby-friendly hospitals in New York City. So that is hopefully my role, and hopefully I have a plethora of support in front of me. And in conclusion, I hope that we can understand how important it is as healthcare professionals, advocates, public health officials, and more importantly, as a community, to continue to aid in fostering and supporting proper breastfeeding practices for the achievement of this preferred public health goal. So thank you.